So I want to welcome you all to the Open Access panel. I'm really looking forward to all the great speakers. Show of hands of how many of you are grad students here? Awesome. How many of you are PIs or principal investigators? Oh, we got one. To start. I've had it's my great honor to introduce Dr. Paul Dufour, who has really helped us put this panel together and also agreed to be the moderator on this. And I've had a great time putting together the panel along with Carlos and Vida, who are somewhere around here in the crowd. But just to introduce Paul, Dr. Dufour is the principal of PaulicyWorks, a science and technology policy consulting firm based in Gatineau. He's also one of Canada's leading experts in science and technology policy and international development. His bio is just punctuated with many declarations of being involved with science and technology at the government level. Just briefly to summarize, he was the research advisor for the Science Council of Canada. He was a senior analyst with the Science and Technology Strategy Directorate at Industry Canada. So basically, he combines what this conference is all about: government, industry, policy. And we're really lucky to have him here as moderator. He's also a native of Montreal and has helped us with Science and Policy Exchange over the years. And join me in welcoming him as the moderator for the Open Access panel.
Merci Vas. I wanted to extend my thanks to Vas and to Alex in particular, and to the whole team here. It's a great treat to be back. Kudos to the Science Policy Exchange for all the work you do in trying to motivate this interchange between science, society, and policy, which is becoming increasingly more important as an issue for anybody who's looking at life after science. So let me just say a couple of quick words. This panel was put together to explore this very interesting facet of the scientific publishing and open science world that's growing, in part, of course, largely as part as a result of social media, but also in the way in which science is being communicated in terms of openness. Now, a lot of you would be scratching your heads and saying to yourself, open science kind of sounds like, isn't that what we always do? But there are some interesting features of this that are developing, which we'll hear from some of our conférenciers this afternoon. I just wanted to highlight one quick thing, and that is that in June of this year, just to show you how important this question has become, or is becoming, in June of this year, the G20 science ministers, these are science ministers and heads of science organizations, met in London, and they issued a statement which talked about a variety of issues that our scientific community writ large globally is looking at, one of which dealt with a very interesting subject that's emerging on antimicrobial resistance to diseases and so on. Another one that they tackled, which had some people scratching their heads about, was open science. And you'd ask yourself, why are governments interested in this question? And there are a number of reasons why they are, including the whole issue of what's going on in terms of ability of citizens to have access to scientific findings. And we'll hear a bit more about that from our panelists. So I'm very pleased to have this distinguished group. C'est la force de frappe dans le domaine qui est ici. Et on va commencer avec Stevan Harnad, who's here from Université de Québec à Montréal, Canada Research Chair in Cognitive Sciences. And Stevan will lay a bit of the basics of what this thing is called Open Science Libre Access. And then we'll follow that with Eric Archambault from Science Metrics, a good friend who's been doing some really interesting work lately with the European Commission. He'll talk to you a little bit about that. To be followed by Nika Pai from McGill, who is going to tell us a little story about why she believes in open science, which is good to know. And then Florence Piron will follow and close the group with a discussion around a particular case that she's been addressing, and she's been very active in the whole issue of science et le bien commun. For those of you who aren't familiar with that group, it's a very interesting association that's trying to push this whole issue of citizen science into the public domain. So that's how it's going to evolve. J'ai demandé 8 à 10 minutes max par chaque conférencier, si possible. Et we'll try to keep them on track, and then we'll open it up for des questions, commentaires, suggestions, autres. Donc, Stevan, merci.
Hello. I'll give you the basics, but first I want to take a show of hands. How many people know or think they know what open access means? And now, thank you very much. Now, anybody want to actually define it? Anybody brave enough to stand up to the microphone and define open access? You all know. Is it very, very complicated? All right. First of all, open access is not about open access to anything and everything under the sun that's digital. There are such movements, free information, etc. Open access is focused on a particular literature, and it is the peer-reviewed research literature. These are journals and to a certain extent peer-reviewed conference proceedings in which articles are published. Peer-reviewed, their quality is controlled by referees. That's the target. And it's especially journals. There are about at least 25,000 peer-reviewed journals in all fields, in all disciplines, science, humanities, all languages, all countries. Perhaps a lot more if you're a little bit flexible with what you mean by peer review. Of those 25,000 or more journals, maybe 10,000, Eric might even have different definitions for what are the so-called core journals, the international journals that are considered to be of high quality that everybody has to have, the must-have journals. And these are the ones that are indexed by Scopus and Web of Science. Maybe that brings us down to something like 10,000, 6,000. If you're really exacting, maybe 3,000 or even less than 3,000. But as you get closer to the core, they become more and more must-have journals. You can't be a researcher if you don't have access to those journals. Now the other thing is there was a inventor by the name of Gutenberg who invented the printing press. And thanks to him, scientific and other, I mean everything, all of the written word, but scientific research and scholarly research could be transmitted to a lot more people than you could send a letter to. So the printing press made it possible to open access to the kind of research that I'm talking about much more widely than handwriting could. But not widely enough because it cost money. It costs money to produce print on paper. It costs money to diffuse it to all of the potential audience. And so there had to be a barrier erected between the author and the user. Now, in other fields, not in the target area of refereed research, but in other fields, books, magazine articles, newspaper articles where journalists write for a living, every place where you're trying to sell your words, nothing that I'm saying applies. There are, as I say, there are wider open movements, and maybe Florence will talk about these, maybe others will. I'm talking specifically about this research literature, and this research literature differs from most other authors of the written word in that these authors do not expect or want pay in exchange for their words. They're not selling their words. They're diffusing their ideas. And it's not, they're not saints. They don't do it because they're doing it for charity. They do it partly because their life is dedicated to research. And the only way to make your research count is if you distribute it to others and they can use it, build upon it, apply it. If they can't access it, they can't use, apply, and build upon it. So it has always been a handicap for these authors that the Gutenberg technology and its real expenses produced a barrier between them and their users, and the only users that could have access to their work were those who could somehow have access to an institution that has a library, an institution that has a subscription. Now, let me quickly say something about subscriptions. It's very important, and already to short-circuit some wrong ideas here, they would usually come from researchers. Students know better because they've looked for things and found out that their university library doesn't have them. But even Harvard, the richest university on the planet and the one with the largest library budget, cannot afford anything but a fraction of these 25,000 or more peer-reviewed journals, and less as the years go by. There was a statement last year by Harvard about the fact that their subscriptions were unsustainable as they are now. So, to come back to what I said, those poor researchers who have devoted their careers to producing research so it can be used, applied, and built upon are deprived of all the potential users that cannot afford subscription access to their work. And that continues to be true even in the online era. And that's why it's deeply disappointing to see only students here, because you all know, right, that this stuff should all be free for you, and you're used to it. In fact, you probably ignore the stuff that isn't freely accessible to you. But the old guard just doesn't know it. The token hasn't dropped, and for the time being, most of the articles in those must-have journals are coming from middle and senior people who are not who have not picked up the ball and run with it yet. So open access is something that has become possible ever since the internet was invented, which is to take these articles, continue to submit them for peer review with the journal, and to continue to publish them, and to continue to allow the journal to sell subscriptions to the print version and to the online version, but to supplement that, or to ensure that a version of it is freely available to all users online. That is what is called gratis open access. There's another stronger form of open access called Libre open access, and I'm sure it'll come up in question period, but I want to suggest now, to save you a lot of trouble, gratis open access is part of Libre open access. It's easier to get gratis open access, and it's necessary for Libre open access, and we don't have anywhere near gratis open access. So one of the things that is holding us up, there are 101 things that are holding us up, is Libre open access obsessives who are saying, no, I want Libre open access. It's even harder to get. It's not within reach. So free online access is a tall enough agenda, and that is gratis open access, and the way I described it was gratis green open access, because green open access means you keep publishing in the journal of your choice, whatever it is, but in addition to whatever it is that you do, you put a free version of your final peer-reviewed draft onto the web, free for all. That is gratis green open access. I am profoundly ashamed of the fact that when I made the subversive proposal in 1994, trivial, absolutely trivial, simply say researchers, I usually describe this proposal as not rocket science, but raincoat science. There's nothing deep in this. It's like saying, kids, it's raining outside, time to put on your raincoats, okay? So in 1994, I said, time to put your articles free for all on the web. But what I'm profoundly ashamed of is that at the same time, I speculated about what was going to happen to journals. I shouldn't have said a thing. It's irrelevant. Journals will find a way to adapt to the new reality just like they adapted to the Gutenberg reality. But no, I said what's going to happen is that instead of user institutions paying to subscribe to journals, it'll be author institutions paying much, much less to publish in journals, because right now the costs of publication, such as they are paid by these subscriptions. So obviously, if everything's going to be made open access, those subscriptions are going to become unsustainable. What's going to come next? That's gold open access. Well, just as Libre open access, which by the way, not to keep secrets, gratis open access is free online access. Libre open access is free online access, but certain other reuse rights, like the right to machine data mine, to republish, to reuse, etc. So extra rights over and above free online access. Well, in the same way that Libre open access is premature and you have to have gratis green first, and gold open access is also premature to even talk about, even though we already have a lot of gold open access journals. I'll talk about that in a second. Because right now, the must-have journals are almost all subscription journals. So if you pay, if you already start to pay, never mind the price they're asking for, but if you start to pay journals to make your articles open access instead of just making them open access yourself, your institution is double paying. They're paying for the subscriptions, and in addition, they're paying for gold open access they're paying for subscriptions for everything they want to get coming in, and then they're paying extra for the gold open access for everything that's going out. And in some cases, they're not just double paying, but the journal is double dipping, because there's something called hybrid gold open access, where you have a subscription journal offering subscriptions and collecting subscriptions from institutions all over the world, and in addition, asking you for extra money if you want to make your own article open access. Well, fie on that, I would say, to speak politely. Deposit your own article in your institutional repository and make it green open access, never mind paying extra for gold open access. Gold open access will take care of itself. Once subscriptions become unsustainable and they collapse, then publishers will cut unnecessary costs. They'll get rid of their print edition. They'll get rid of their online edition. Who needs it when you've got it through the institutional repositories already for free? And the only remaining service, I remind you, that these journals will be providing, a peer-reviewed journal will become a peer-review service provider. That means they will manage receiving your submitted article, picking the referees, hassling the referees to get the reports in on time, evaluating the reports, telling you what you have to do, if you either rejecting you or telling you what you have to do to revise it to make it acceptable, and then checking whether you've done that. That's the part that the journals will continue to do, but that's only a fraction of their expenses now. If all those other expenses disappear, instead of charging $1,500 to $3,000 to $5,000 to, some people even said $20,000 per article for gold open access, they'll be charging something like $200 per round of peer review, and there'll be no fault rounds of peer review. You'll be paid for refereeing, but not for the outcome. If the outcome is it's no good for this journal, then you have to revise for another journal. You're paying for the peer review and for the certification that you've met the standards of a given journal. That will be post-green gold open access, fair gold. Gold on open access now is fool's gold. It's paying double, sometimes double dipping, allowing, anyway, so enough about the economics. I have 2 minutes left. Then in that case, I just want to show you this is a curve. The green curve on the right, the one that goes up fast, is the curve of citations. By the way, one of the signs that somebody is using, building upon, etc., your work is that they cite your work. So you can count citations. The green curve shows the citations for articles in the physics archive that were deposited and made freely accessible to all. The red curve, starting from the date of publication, you'll notice that physicists are even smarter than other disciplines, which are pretty stupid anyway because they don't provide open access. But physicists not only provide open access, but they do it earlier. They even provide open access to the unrefereed version of the article. When it's refereed, of course, they make it accessible, and then at publication, in physics, the situation is better because, for example, in astrophysics, just about all of the research active astrophysicists have access to the journals, but as you see, the ones that wait for that last minute for journal access get much less citations, and it never actually catches up. Now this effect is too dramatic. It's inflated by the fact that it's the better articles that are made open access first, etc. So there are other additional factors that are responsible for this difference, but on the left you see that we checked that for all disciplines, and I can tell you that in all of the disciplines we looked at through all time intervals, open access articles are always cited and also downloaded, of course, more than non-open access articles. Now, what else have I got there? So that's the reason for doing it, and that's the reason that I'm saying physicists are more intelligent than other disciplines. Now, where's my next one? What do I do to... Can you make the next slide appear? I just want to set the things up for... Eric is going to give you good news. I'm the pessimist, he's the optimist. He's going to tell you something like 50% of articles are already green open access, or already open access, green plus gold. And I'm here to tell you that no, not quite, because what I showed you with that time curve is very important. Those articles are the ones that were... Could I go back one slide? I'll stick... If I knew how. Okay. Notice that the later deposit at publication date never catches up with the earlier one. And that's because science and even scholarship has a pace. You need to strike while the iron is hot. And the things that become open access later, delayed, are losing their impact. Eric will give you very promising figures on the entire, at a given time, how much is open access, and within, say, a year and a half of publication. And I'm saying that open access, green open access, needs to be immediate. We should call everything else delayed open access. We'll give an excusable period of a couple of months, but not more than that. Now let me tell you that the things that are being deposited, in institute, I'm going to just rush to something that Eric is going to be.
Is there.
Okay, okay. Can you? This is the gold open access and green open access across fields. I can tell you, can you go back one slide? If you look at all of the different fields, there's a lot more green open access, but that green open access is ambiguous. It includes immediate green and late green. When your article has appeared in a year after, or 2 years, or 5 years, or 10, or 15, or 30 years later, you make it open access. I don't think that should all be called green. I think you should only call green open access what's immediate, and immediate means within a few months of publication at latest. Can I go to the next one? That's the proportions. Next one, please. Now, here, this is the slide to bear in mind, because my remedy for all of this is the Liège model open access mandate. On the left, we have UK, United Kingdom repositories that are not mandated, and the ones that are mandated. The gray is the stuff that's not accessible for free online. The green is the stuff that is. The dark green is immediately open access. The pale green is deposited in the repository, and it's not quite ready for Eric to call green open access. It's restricted access, but there's a button in the repository that allows any user that wants a copy of a restricted access article to press the button and request one copy for research purposes, and the author presses one button in his email and it's sent automatically. That's almost open access. So pale green is almost open access, green is immediate open access, and those together in Liège, which has a joint mandate from the university and the research funders that require researchers to deposit. It requires the children to put on their raincoats, if you stick to my raincoat analogy. The statistics are completely different, and if the Liège statistics were true about the whole planet, we would already be there. We're not. That's it. My time's up. Thank you.
So basically, Stevan set up Eric, and Eric's going to now talk to you a little bit about some very interesting results, positive results, I think, about a very interesting study that just came out of the European Commission that he's finished.
Thank you very much, Paul and Etienne. Yes, I'm going to present some of the results of a study that we conducted and still conducting. It's a 2 years project for the European Commission. We've been asked to measure the availability of green and gold open access in that contract. So I thought, okay, my specialization is measurement of scientific activity. It's going to be an easy one. Actually, it's a can of worm. When we started the project, we thought, okay, our trade is really in measurement, so we're going to try to be precise, which is what you see on the lower target. That is, if you do a measurement and you do it frequently enough, at some stage you converge on a measure and you say, okay, this is the true measure. When we did the work, what we noticed is that we had a big problem of accuracy. People, I think, weren't measuring the center of the target. Now, ever since I published my results, I've been arguing with Etienne here, what is the meaning of the center of the target, which is always a problem in measurement, is that not only you need precise measurement, but have you been going to enough seminars now you know that people frequently ask, what is your definition of whatever you want? So there's a big question of definitions here, and I'm nearly becoming embarrassed to speak of open access just because our friend here is so much more sophisticated.
I'm on your side. I'm on your
side. Yeah, we're both on the same side, but we're having gentleman scientific discussion about that to make sure that we both improve our way of calculating it, which is our main object. Well, he's got more objective than I. My job is to measure precisely. Etienne would want to measure precisely as well as convert the old world. I don't have the second mission yet, though I think he's doing something extremely important, no doubt about that. Okay, so accuracy is the capacity to hit the target in the center, but you have to know what you want to hit. Statistical precision is the capacity to have repeated measures that converge. So we thought, okay, let's do a very high number of measures, and then we'll have something that is precise from a statistical point of view. Retrieval precision is very important. That's your tool, the instrument that you use to actually do the measure, which is distinct from the statistical precision. That's the two last ones are terms from information science when you speak about precision and recall. Recall is your capacity to retrieve all the records and not to miss records, that is, having false positives and true positives. Okay. Now, we diverge here a bit, but we see eye to eye. Huh? It's different ways of this field is still very evolving, and as we measure something, encounter some difficulties, then we improve the definitions. Gold OA refers to journals that use a funding model that does not charge readers or the institutions for access and make all the contents available without embargo period. If you want to see what is gold at the moment, go to the directory of open access journal, DOAJ, and you'll see that at the moment, as of today, there's more than 9,000 such journals. And what is interesting is that it's a more complex portrait than we think. Most of them, actually, the majority, do not charge upfront fees for publication. I was surprised about that.
And the majority of the journals people don't want.
Yes, that's a different issue. It's, of course, if you want to do great things, it's easier when you have money. That's why he's saying translation. Green OA generally refers to authors self-archiving of papers accepted in academic journals following a successful peer review process. I think we agree on this bit. That's the point where we have an agreement. And perhaps that also Stevan will agree that that hybrid OA is a complete mess, okay? Basically, whatever doesn't fit up there and in the center, I throw in the other bin, which is called hybrid. It comprises the model whereby authors pay for their papers to be available in open access, but in the journal that is otherwise subscription-based. So this is what Etienne was referring to, the double dipping model, because basically the libraries will still be paying for the subscription. It also comprise disembargoed papers. So these are editors after like 2 years or sometimes 1 year, 3 years, every situation is possible. They decide to make papers available for free. They've earned enough money with the subscription. They say, okay, we're not earning enough money with those. They're now available. So these are disembargoed. And then there's some transiency on the web. And we're having discussion with colleagues in Finland about whether they should be counted or not. There's several types of transiency. There's people, for example, if you go on a researcher's website, sometimes they put their papers in there. Some of them disappear after a while, so it's transient. They've been there for a while. But also editors sometimes make promotions. So some of their papers will be available for a month or two, and then they'll be told access again. But generally, I'd say everything that isn't gold or green fits there. And we will need to open this box and disaggregate it. And same thing for gold and green. There's very many different flavors of this, and it's very important to develop a rigorous vocabulary to know what we're talking about. So this is coarse here, okay? We have to agree that these are coarse categories. where we thought we had something important, at some stage we sent blindly a sample of papers to Etienne's colleague at UQAM, and we asked him to use their approach to measurement. And when we got the result, we saw that this was bringing back 30% of open access, freely accessible papers, so that I don't have a problem with definition, okay? Everyone will agree that they were freely available. I thought, okay, this is interesting, because what Etienne has been doing in the past was measuring with a different database. I was measuring with Scopus, he was measuring with the Web of Science. So there was already a creep upward of about 7 to 8 percentage points, nearly 50% more. Then we took this sample, and with a toothbrush and a lot of patience, we went article by article, digging as far as we could by hand in both Google Scholar and Google. And we saw that if you're really persistent, you can find actually in Google Scholar 41% of the articles as opposed to 30%. So we would say, using the terms that we used before, we would say that the recall of his engine is about 75%. So we thought, okay, we have a problem, he's not hitting the target. So we have, as someone who likes measuring, we thought, okay, we have a challenge there. Same thing, Google, about 42%. We were surprised. We can actually find a little more articles in Google than in Google Scholar. When you actually take the union of Google and Google Scholar, you find something new, and you're at about 48%. So we thought, gosh, that's far from the measure that I've been reading before, because the consensus seemed to be going between 20 and 25% of the articles from 2008, which were available for free at the time of measurement. Now, this is very important. The more you go in time, the more you will find, just because the movement is growing. So you have to see when you're measuring. That's very important. Okay, so we just have a little bit of statistics here on the strengths of our engine. We did a measure with 320,000 papers in our sample. And using, again, a subsample of 500 that we did by hand, we found that we have a retrieval. What is important, okay, recall last line. We're still missing 14% of the papers with our engine, because it's not perfect. But we have very good precision. The second one, 98%. That means that of what we're catching with our engine when we're measuring, only 2% are not real. Shouldn't be counted as free. So at the bottom, you've got the gold open access as measured within the Scopus database. Of course, if we had another database, it would be slightly different. So we have, in 2004, slightly less than 5% of the papers were published in gold open access journals, according to, again, what we measure in Scopus. And now it has moved to about 12%. The green and hybrid, we had to combine them for technical reasons because we didn't have the resolution to be able to separate them with our engine. What you see, the fact that the curve is going down is not because the movement is going down. It's because of several factors that has to do with the fact that papers are not available instantly. And this is what Etienne is saying that is very important, is that they become instantly available. What you see there very clearly is that they take a while before they become available. That's why it's going down. It's not that the movement is fading. When you combine both curves, you have something that is more or less like a line. And the top one is when we adjust for both the errors that we have, that is the false positives, but also the recall of our engine, which is not perfect. And this is the readjusted figures, more or less, what it's giving us. So what we see is that by 2011, about, when you look 2 years later, though, that's important. Again, it has to do with the time it takes to go in the free domain. We have about 50% of the papers that are available for free. But that would be a large crowd of people who know their field looking for articles are of interest to them. That's about what we would find. So freely available, I didn't use open access just to be safe. Scientific journal published peer-reviewed literature is nearly twice what has been measured. The compound growth rate is low, but the thing is that the curve is not moving up all that fast, but there's a translation movement, okay? The curve is also moving upward over time as a whole, because a lot of people, when they decide to go in their institutional repository, they will make all their publication available all of a sudden. So they'll do it for previous years too. That's why it's not so much the slope that is important as the combination of the slope and the translation of the curve. The transient effect have to be considered when measuring OA availability. What I think is that the toll plaza, which a lot of people speak about toll or no toll, I think there'll always be a toll because we need food to live and we need money to pay for the food. So the toll plaza, I think, is being moved from the exit of the bridge to the front of the bridge. I think this is the main movement, and there's a lot of panic from editors. Yes, there'll be gales of massive destruction, of creative destruction, as Schumpeter would say, but the industry will still be there, I think. The market, what I think is very important is that the market power will shift tremendously from tens of thousands of subscribers. At the moment, who's making the decision is the librarians. In the new model where we'll have it's going to be way more optimistic because every researcher will decide where she or he puts his research money to publish. So that, I think, will make the large publishers freak out because they're used to have a cozy relationship with librarians, and now they're going to have to build relationship with researchers. And for those who've been following the scene, some publishers, such as Elsevier, don't necessarily have a very friendly relationship with researchers at the moment. So big challenges ahead. Thank you very much.
Stefan's just going to say 2 words on this.
Not because I have to say anything about everything, but I know how human mind works, and you're going to forget what he said once we move on to the next speaker. We're on the same side. He's more optimistic about what that 50% really means than I am. And the reason I'm less optimistic that we've really gone that much further than we thought is exactly because of this timing factor. Yes, the curve is going up when you put your articles on 5, 10 years, or 5, whatever years later, but that's not what we're working for. We want science to progress, and that means you need it immediately. That's all. And the only way to get that is to require researchers to deposit immediately, and that's the mandate that I was talking about.
Merci, Eric. By the way, just a quick point. Just a quick point. You know, this is a lot of material to go through, obviously. All this stuff, of course, is available, freely available on the web, and open access to Eric's stuff is available on this. Our next presenter is Nikki Pai, who will speak to us about why this is important. But just before I introduce her, say a few words, let me just make a point. Nikki is a Grand Challenge Canada winner. She has won 2 very large, substantial awards from a very substantial organization that addresses global health solutions using science in the developing world. And for those of you who may be interested in global health questions writ large, right, as a career or something else, I just want to make a pitch. Talk to Nikki. Vas-y, à vous.
Thank you for that introduction. Wow, that was a very educative experience for me too, to understand the differentiation between green and gold. So thank you. I'm going to talk about something that is fairly simple, something that has touched my life, as to why I believe in open access and what role it has played in my life. So I'm a physician and an epidemiologist by training in medicine. And as you can see, I moved from India and to US and then to Canada, and I do research in different parts of the world. And my story begins with 14 years ago. I was in surgery, and I was on call assisting with an inguinal hernia operation, and I ended up asking my chief, does this surgery really work? So he looked up at me through the middle of the procedure and said, of course it does. And I said, how do you say that it works? Because I was at the OPD, at the receiving end of these patients who were coming back to us, 14 to 15, sometimes 4 to 5 years down the line with recurrence of hernia. So as somebody growing up in India, where the access to journals was not really strong, and this is about 14 years ago, I felt the need to look up literature. So I went to the library, musty old libraries we had, and tried to dig out all the journals to find out how many patients across the world had recurrent hernia. And I found that there were lots of cases, but the problem was that we only had access to JAMA and a few surgical specialties, but we didn't have access to a lot of other journals. So disappointed, I went back, and I also decided that I have to take up evidence-based medicine as a specialty, because that's where it matters, rather than, you know, arrogance-based medicine or vehemence-based medicine or opinion-based medicine. So a few years down the line, I moved to California. And I always believe in Stephen Covey, who says there are 3 constants in life: change, choice, and principles. So as long as you stick to your principles, probably you'd be fine. So then I made a transition from surgery to medicine, global health, and epidemiology. And it was then around that time Google was born. So I was in California and Google was all over. So I was hooked onto the internet like you guys are. And there was some good stuff like open access that was coming up. So the only journal at that time was Biomed Central, and we were very excited about that. And I was really drawn to evidence. So what I did was, I did some Cochrane reviews that are the top quality reviews for generating evidence. I did go to jail. I didn't go to jail, you know, I went to jail for research. So, and I did publish all of that work in open access journals. And then I took my, I looked at this oral rapid point of care test, which is an oral rapid, saliva rapid test that helps pick up HIV. And I wanted to prove accuracy of this test in a rural setting in India. And having done that, I published it in PLOS ONE, and the dissemination of my work was really rapid. People wanted to really know as to how it worked, and they also wanted to know as to how, you know, what the next steps would be. So I must say that I really benefited from open access, because, you know, lay people would call me, people from Peru all the way to Singapore and, you know, different parts of the world. I was busy answering, and as a young graduate student, it was like one of those, you know, you get really happy about stuff like that happening. I took the oral test to the labor room, and I wanted to use it as a tool to prevent HIV transmission. Now, you would wonder how that could be done. So we developed an oral round-the-clock rapid testing and counseling strategy, where we screened all the women that were presenting in labor in the morning at 4 a.m. You know, labor never happens at night. It always happens when there's nobody on at the hospital. So we used this oral saliva-based strategy so that we could screen women and give them treatment, despite the fact that treatment was available. There weren't many technicians to conduct testing on site to give them medicines. So we proved that, and that was also published in open access, and it was very well received across the world. And then I love writing editorials. So, you know, some of those editorials, I guess these are a mixture, hybrid journals that helped spread the word. And this is an Elsevier journal. So we also proved the accuracy of this oral test in a meta-analysis last year that really proved that these tests could also be used as self-tests. I don't know why this moves around. Am I clicking it? It moves really fast. So that being said, again, this is not open access. So, so we proved that these tests were as effective as blood tests for self-testing, and this really helped set the tone for oral rapid tests. And then we also developed, with Grand Challenges funding, we developed an internet-based self-testing program and evaluated it in South Africa recently. And we proved that if we synergize the oral test and we offer a confidential self-testing program to healthcare workers, they would probably use it for testing for HIV. And we're talking about South Africa that has one of the highest burden of HIV in the world. There are lots of facilities to offer HIV conventional facility-based testing, but people do not wish to get tested because there is a lot of stigma and discrimination around HIV. And there is also the social visibility associated with HIV. People do not like to be seen in such settings. So we developed this program, and then we also developed an innovation, which is the HIV self-testing app. So if I have some time, I can show it to you. This app is right now not yet launched, but it's developed for an Android, and it can guide you through the process of self-testing. So in case you wish to self-test yourself, it explains all the things and all the steps that you need to go through to be able to self-test yourself. You can understand, you can get information about HIV, you can conduct testing. And I don't want to give it away, but yeah, you can interpret your test results, you can seek linkages, all of it confidentially with the phone and with the test. So that being said, I want to conclude with some shlokas from Sanskrit, and that's about knowledge. So I don't think I'll torture you with my Sanskrit, but the moral of the story of these two shlokas are: knowledge cannot be stolen by a thief, it cannot be taken away by a king, it cannot be divided amongst brothers. Knowledge always increases when shared. So somebody knew open access when he created this shloka those years ago. And the wealth of knowledge is the greatest of all wealth. So in Sanskrit, it's na choraharyam, na rajyarajyam, na bhratabhrajyam, na bhavichkari, vyarthate, so vyarthate kruta vardhata. That means when you give it away, it multiplies. And vidya dhanam sarvdhanam pradhanam. So it is the wealth of knowledge. So all of us, what we're doing, we have the biggest wealth of all. So we should be really happy, right? The second shloka says that vidya dadati vinayam, vinayadi yat patram, patrati namopti. See, my Sanskrit isn't perfect anymore. Danadam tata sukham. So knowledge gives you humility. From humility, one attains character. From character, one acquires wealth. And from wealth, good deeds follow. And then follows happiness. So open access is one of the keys to happiness because it allows you free discussion. So if I have a minute, I can show you my innovation. I see a bright future for open access. Thank you.
Merci, Nika. By the way, for those of you who were here earlier this morning for the family medicine presentations, right? I mean, this is a very interesting development that's taking place in the developing world, right? In many respects, using mobile platforms, right? To be able to do self-diagnosis and so on. It's very interesting to see how that's happening right now. OK, on est presque rendu. Florence va nous présenter quelque chose vachement intéressant, sans doute, qui va parler un peu de son expérience directe avec des études de cas dans Open Science. Florence, à vous.
Merci beaucoup. Alors, je vais parler en français. Je pense qu'il y a un traducteur, mais j'ai mis... there is a lot of English in my slides, so you may manage. Comme on vient de voir avec les présentations précédentes que la question de la open access de la science ouverte remet en question les pratiques de publication des auteurs, des maisons d'édition, mais aussi le phénomène plus large de la marchandisation du savoir, de la connaissance. Or, ce phénomène a des conséquences très importante sur la pratique de la médecine et de la santé. Je serais intéressée de discuter. Et l'accès libre, donc plus largement, la science ouverte. Moi, je vais parler, comme le disait Étienne, plus largement de la science ouverte qui inclut l'accès libre aux publications scientifiques, mais aussi l'accès libre à tout ce qu'on appelle parfois la littérature grise, c'est-à-dire les rapports de recherche, les carnets de laboratoire et même les données brutes de recherche. Donc ça a une dimension particulière pour les politiques scientifiques dans le domaine biomédical. Et donc j'ai beaucoup aimé le titre du panel « Who owns science ?» Ce n'est pas uniquement les chercheurs ou les maisons de publication, mais il y a aussi en arrière toute l'économie du savoir. Donc, j'y vais directement. Pour moi, l'accès libre, c'est une façon de résister à la pourriture de la science. L'accès libre ne vise pas seulement à améliorer la qualité de la science et son accessibilité, mais il peut aussi résister à un mouvement, et je vais être un petit peu moins optimiste que mes collègues sur l'état actuel de la science. Donc, un petit contexte sur la recherche biomédicale, qui est largement financée par les compagnies pharmaceutiques, même si elle se déroule bien souvent dans des institutions publiques. La santé est devenue un enjeu majeur de nos sociétés. On parle de healthism, santéisme. Et au nom de cette valeur, de l'amélioration des soins de santé, le public est prêt à accepter énormément de choses, et notamment qu'on y consacre beaucoup d'argent. Les soins de santé sont très largement dominés par le secteur biomédical, au détriment des déterminants sociaux de la santé. Donc de la recherche sur le fait qu'on peut améliorer la santé des gens en améliorant les conditions de vie, en luttant contre la pauvreté, etc., et pas seulement en imaginant des nouvelles molécules. Et l'économie du savoir, qui domine la politique scientifique du Québec et du Canada, comme vous devez le savoir, promeut une science qui est capable de générer des inventions qui deviendront ensuite des innovations technologiques. On vient d'en avoir un exemple, même si elles sont controversées dans l'espace public. Et j'en ai vu un exemple frappant hier à McGill même, où on a annoncé qu'une professeure, Luda Diatchenko, vient d'arriver pour lancer une chaire de recherche contre la douleur en médecine personnalisée avec 30 millions de dollars de subventions, dont une grande partie de fonds publics et une partie donnée par la compagnie pharmaceutique Pfizer. On espère qu'elle va publier au moins en accès libre. Donc la recherche biomédicale est sous pression parce que les politiciens veulent qu'elle améliore les soins de santé et crée de l'emploi. Elle doit tenir ses promesses pour justifier la part de budget accordée par l'État aux soins de santé. Les financiers, les investisseurs veulent que leur investissement rapporte. J'ai rencontré lors des assises nationales sur la politique scientifique du Québec deux personnes responsables de la recherche dans deux compagnies pharmaceutiques très importantes qui m'ont expliqué que la découverte d'un nouveau blockbuster, c'est-à-dire un médicament qui allait se vendre comme les statines, etc., était de plus en plus improbable, et donc ils se tournaient vers la médecine personnalisée, dont vous allez avoir une nouvelle chercheure extraordinaire. Et donc c'est la nouvelle voie qui va multiplier les tests génétiques et les emplois dans le secteur de la génomique. Donc une pression financière, et les chercheurs veulent avoir accès à ces fonds de recherche, même si ça limite leur capacité de publier librement les résultats de leurs travaux. Alors j'espère que vous connaissez tous l'histoire de Nancy Olivieri, cette médecin de Toronto qui a publié des résultats négatifs d'un essai clinique et qui s'est fait poursuivre par la compagnie pharmaceutique Apotex, selon laquelle elle avait brisé la confidentialité. Et ça peut aussi les conduire à cacher des résultats de recherche ou falsifier des données. Et c'est là que la question de la science ouverte est cruciale. Ce que le procès, par exemple, autour du médicament Paxil a montré au début des années 2000. Donc c'est ça. Alors, avec ce procès Paxil, on s'est rendu compte que les essais cliniques sont derrière le mur. Qu'il y a près de la moitié des essais cliniques ne sont jamais publiés, c'est-à-dire ne font jamais l'objet d'une publication évaluée dans une revue, mais même d'un rapport de recherche. Les publications sont souvent incomplètes, on ne présente que les rapports favorables et très rarement les rapports négatifs. Et or, c'est vital pour le système de santé, de pouvoir se fier sur des evidence-based, des données correctes sur la valeur des médicaments qu'on essaye. Donc il y a des mesures politiques pour briser le mur. Par exemple, aux États-Unis, il y a l'organisme Clinical Trials qui essaye d'obliger les chercheurs à publier tous les essais cliniques qu'ils font. Mais malheureusement, c'est des résultats mitigés parce que les données brutes des essais cliniques ne sont pas rendues publiques et les chercheurs peuvent choisir ce qu'ils rendent public. Autrement dit, ils peuvent entrer dans des contrats qui limitent ce qu'ils vont rendre public. Donc c'est dans le cadre de procès judiciaires qu'on a découvert de nombreux essais cliniques sur les médicaments. Et en particulier, on a découvert aussi un autre phénomène dont j'espère que vous êtes au courant, surtout dans le domaine biomédical, qui est le ghostwriting. Le ghostwriting, alors j'ai essayé de l'expliquer parce que c'est un petit peu compliqué, mais à des fins de promotion d'un médicament, une compagnie pharmaceutique engage un rédacteur médical payé, donc là on n'est pas du tout dans la science décrite par Étienne, qui va rédiger un article dans un style scientifique, qui va ensuite être signé par des key opinion leaders, qui sont en général des médecins d'universités prestigieuses, contre rémunération, et qui vont ensuite être soumis au processus d'évaluation par les pairs et publiés dans des grandes revues scientifiques. Alors le ghostwriting, ce n'est ni rare ni insignificant. Tous les médicaments ont été tainted by charges of ghostwriting. Donc, évidemment, la solution pour résister à ce que j'appelle pour moi de la pourriture de la recherche scientifique par la marchandisation de la connaissance, rendre public les articles, rendre accessibles évidemment les articles scientifiques, mais aussi les rapports de recherche, les carnets de laboratoire et les données brutes paraît essentiel. Alors évidemment, ça rencontre énormément d'opposition de la part, bien sûr, on s'y attend, des compagnies pharmaceutiques qui vont dire que les données sont propriétaires parce qu'elles ont payé, elles possèdent cette science, c'est who owns science, c'est celui qui a l'argent. Elles vont dire aussi que c'est dangereux pour la confidentialité des renseignements personnels des patients, donc elles vont invoquer l'éthique, mais l'éthique de la recherche. Elles vont expliquer que ça dissuade l'innovation médicale, parce que dans le fond, si on partage toutes les bonnes idées, on va perdre l'avantage commercial. Il y a même récemment quelqu'un de la compagnie AbbVie qui a dit « Info on adverse effects of drugs should be considered commercially confidential ». Et qui poursuit l'Agence européenne des médicaments, qui veut au contraire faire comme aux États-Unis et faire pousser la publication des essais cliniques. Les chercheurs, alors ça c'est un peu plus triste, et là on retombe un peu dans ce qu'on a vu sur les publications. Il y a des chercheurs qui s'y opposent aussi, qui estiment que cette étape-là du partage des données ou même de la publication coûte cher, que les données pourraient être mal interprétées ou mal utilisées, avantager des chercheurs rivaux. Et j'ai vu récemment, je ne sais pas si vous connaissez le réseau social scientifique ResearchGate, il y a des discussions absolument fascinantes pour l'anthropologue des sciences que je suis, qui explique que de publier les résultats négatifs, c'est mauvais pour la réputation et la carrière. On met tellement de temps dans un article, si c'est pour dire que notre hypothèse était mauvaise, c'est pas bon pour nous. Donc, dans les pratiques culturelles des chercheurs, il y a de l'opposition. Alors, heureusement, il y a des oppositions. Il y a une grande campagne qui s'appelle All Trials, qui a commencé en janvier dernier en Angleterre, qui fait un appel pour présenter, pour que tous les essais cliniques soient enregistrés et publiés, et que tous les résultats soient publiés. Vous pouvez... Alors voilà ce que propose All Trials. Ça va donc de l'enregistrement des protocoles, le résultat des résumés et un rapport complet sur l'essai clinique. Ce qui est extraordinaire, c'est qu'il y a une pétition en ligne. Si vous allez sur le site, vous pouvez la signer. Il y a plus de 50 000 signatures et de plus en plus d'organismes y ont adhéré, et il commence à y avoir même des compagnies pharmaceutiques, Glaxo, qui a dû payer 3 milliards d'amendes pour son secret autour du Paxil, a adhéré récemment à cette campagne. Oui? Donc, que doivent faire les chercheurs? Alors moi, je suis très contente qu'il y ait des étudiants ici, parce que c'est vous qui pouvez peut-être changer les choses. Continuer le modèle dominant, se consacrer à la publication d'articles scientifiques évalués par les pairs en acceptant les conditions imposées par les maisons d'édition, ou au contraire, revendiquer le droit de déposer négocier avec les maisons d'édition, premièrement, déposer ses articles dans des archives ouvertes ou des dépôts institutionnels, et aussi publier, aller plus loin que leurs articles, publier, rendre accessibles sur Internet leurs rapports de recherche et même leurs données brutes. Les gouvernements et les universités, qu'est-ce qu'elles doivent faire? Accommoder les donateurs industriels en protégeant leurs pratiques du contrôle de l'information scientifique, ou les amener à comprendre que leur intérêt à long terme est la transparence. Donc cette deuxième voie, évidemment, celle qui privilégie l'accès libre et la science ouverte, exige une transformation radicale des pratiques culturelles en sciences biomédicales. Donc je termine en disant un autre système de valeurs est possible. Considérer la recherche scientifique comme une marchandise ou un investissement, les données de recherche comme des avantages commerciaux qui appartiennent à ceux qui ont payé, c'est un système de valeurs parmi d'autres. Et un autre système de valeurs est possible, que Marie Curie, Fleming et bien d'autres ont utilisé. Il y a en ce moment des projets, vous tapez Open Science, des projets absolument passionnants qui montrent qu'il existe une autre façon de faire de la recherche, notamment en Global Health. Vous pourrez regarder par exemple les travaux de Jean-Claude Bradley, qui est un biochimiste, qui travaille sur la malaria et qui met en ligne toutes ces données de recherche, tous ces carnets de laboratoire. Il a inventé quelque chose qui s'appelle Open Science Notebook. Il met ça en ligne sur un wiki et ça lui a permis de développer des collaborations avec des chercheurs d'un peu partout dans le monde sans aucun argent, donc en toute indépendance. La recherche biomédicale, et ce ne serait pas un scandale, peut vraiment viser le bien commun.
Merci beaucoup, Florence. Well said. As we've learned, there's open science, there's bad science. It's interesting, by the way, to see the two sets of models that have been presented here draw on the debate that's taking place in the UK on open science. There's quite extensive debate in the United Kingdom right now around all of these debates, and if you're interested in that other website that Florence just mentioned, have a look at the website called Bad Science, which is kind of an interesting one to look at. Okay, we have about 15-20 minutes, Vas tells me. Donc, on ouvre pour discussion, commentaires, questions, autres. Feel free, don't be shy. Please identify yourself, and we'll, to any one of the panelists, all of the panelists, have at it. S'il vous plaît.
My name is Carlos. So thank you for coming. It was really a great panel. It's very enlightening and great to see that researchers, are thinking about this. I truly think that the further initiatives must come from students, because in many ways they are the ones who did the research and they push their PI to publish in academic journals that pursue open science. But I'm kind of pessimistic on the other side, because of how pharmaceutical companies are now associating themselves with research institutes in order to have new molecules or new treatments. And so you're seeing this model where there's a corporation between a pharmaceutical company that gives some money to an institute to hire some students or researchers to do a project, and that 5 years later they have to have some results. I'm still questioning on what are the limitations of these publications after this 5 years. If it has been funded by these pharmaceutical companies, will they still be open to publications in open science, or will they restrict the results? And if it's the other case, well, how can we enforce, I guess, the pharmaceutical companies to be more open when they do these collaborations with institutes?
Yes, I think that this is a very, let me tell, I think the green open access practices insist on the power of the author. The author is not a slave in front of the publishing houses. Sometimes it's only autocensure. I mean, the researchers are afraid to displease the publishing houses, to displease the and they tend to give up on their copyrights. And so it's really a matter of empowering the researchers, whether they have been funded by government or pharmaceutical, they remain the owner of the rights of their papers, you know. So this is the things that Etienne advocates, that authors do not have to submit themselves to the publishing houses' will, but neither to their leurs investisseurs, leurs financeurs.
Right. No, I agree with that. Sorry, just to follow up on this argument. But I always think that there will always be researchers that will tend to do this, right? Most of them, you know, will want, obviously, to not have to apply this kind of model, but some of them won't mind. The mindset will be different. And so, do you think that it would be necessary to actually impose something on researchers that whenever they're collaborating with pharmaceutical companies, you know, whatever X amount of results or all results have to be published in open access at one point?
The road to open access is littered with misunderstandings. And this is one of the big ones. Two things are being squarely conflated over here, and if you've been paying attention, you should notice it. Open access is about making published research accessible not just to subscribers, but to all potential users. That's open access. Open data and concealing results, etc., is another issue. The two are not the same issue. So what is it that you want people to do? What is it that you're requesting here?
I guess that they are intertwined between both.
No, they're not intertwined.
Yeah.
No, my question.
Oh,
my
you're
question is.
intertwined in two things.
No, my question is.
Can I think what you're talking about, if I understand it correctly, is conflicts of interest, right?
Right.
Right. So that, I think, has, and ghostwriting, that has been taken very seriously, especially in the world I come from. And you are supposed to declare every conflict. Like if you are a respectable author who wants a reputation, you have to declare all the stocks, ownership, consultancy, expert testimony, everything. So if you really want that credibility, people do declare. So it's you know, journals are not taking up manuscripts for publication without having clear declarations of conflicts of interest. I think it's always good to, I don't have any conflicts, I don't work with industry, but it's always a good track to take to declare everything, even if people have conflicts. So there are quite a few people that I know, they write, you know, they openly declare. But open access, as Etienne talks about, is, I think there are two different things.
Mm-hmm.
I think you have to say.
Just in fact, yes, I disagree. These two things are very related. It's not just an academic question on one side and a political or economic question in the other side. They are mixed.
Merci à tous nos invités. Je pense que les présentations ont été très bien préparées et nous donné une bonne résumé de tous les enjeux qui sont en jeu. Donc, ma question, c'est plutôt sur le cas du Canada. Qu'est-ce qu'on peut prendre des autres juridictions qui ont déjà fait l'exercice de rendre les données ouvertes? Personally, I think that in Canada, I think that there's a large will for publicly funded science being made public to, you know, articles funded by taxpayer dollars, by public funds to be open access articles as well. So I think there's a will for this in Canada, but I think there are also certain, maybe we can learn from other jurisdictions who've done it differently, who've made mistakes and also who've put into place best practices. So my question is on what we can learn from these exercises and what we can take away from those.
Yes, Canada is actually moving at the moment. There's a lot of talk in Ottawa. I know that the granting councils are examining models to support open access, whether they'll put money up front and so forth. I think they have to look at what's going on in England at the moment. This is where it's moving fast. I think a lot of the errors that were made in several places well, I won't say they're being undone, but at least there are some voices telling people to undo them. So I think in terms of jurisdiction at the moment, the place to look at is England for the perfect model, okay? Now, being the optimistic, I think failing is a step towards in the right direction as opposed to not doing anything. So I would say whatever happens at least is going to move us forward towards having greater access to the scientific literature. But I will agree with the next presenter that the right model is probably not going to be used there in the short term.
Eric is wise and patient, and I'm not. No, don't pay attention to the UK. They just made a big mess up last year. The UK is the one to ignore right now, although I think Eric is talking about the fact that things may be repaired. Yes, Biz. The things may be fixed in the UK, but why watch somebody that's had something good, then broke it, and now maybe may fix it? I mean, jump over Europe and go straight, jump over the UK and go straight to Belgium. I told you that the optimal model has been adopted by the Belgian funders and by the Belgian universities. Francophone Belgium, I have to point out, not Neerlandophone Belgium, who has nothing, just like Canada has next to nothing. Canada has next to nothing. What Canada should do, what Canada's funders and Canada's universities should do is adopt the Liège model, and you'll have what you want.
There you have it. Next question, please.
Hi, I'm a graduate student. I believe in equal access, open access, and I also know it's good for my career to publish in open access because then it gets out. But there is this problem when you publish in a journal that is not open access. How can you distribute your work? How can you make it online? What I understood from the first speaker is that you should put it online anyway. But I know that I've signed agreements saying that I should not do that, and I know my professors have had different opinions to me as to whether I should put this online or not. I was wondering your opinion. Thank you.
Put it online.
Put it online.
What kind of repercussions are there for something like that?
If you're worried,
Yeah.
are you at McGill?
Yes.
Put it in the repository, and if you're really timid, put it in as restrictive access and exercise your fingers every time somebody wants a copy. You can hit your email and send it to them. That's perfectly legal. If you don't want to, if you get tired of exercising your fingers, use one more click in order to make it open access, and you don't have to keep doing that. But your choice.
He's wise, I'm impatient. The PDFs of all my scientific articles can be found on our website. They're in breach of copyright, and I'm waiting for them to come and tell me that what I wrote cannot be given to other people.
It's called the default option. Voilà. Please.
I'm also a master's student in chemistry, which I think is one of the heaviest fields, which has...
The worst. They'll be the last ones to close the door behind them.
Oh, absolutely. And I think, though, especially in that field, you have a lot of the newer, younger professors are the ones who are most interested in really kind of pushing this. But at the same time, they're also at the most vulnerable point in their careers, right? With the whole adage of publish or die, which in chemistry is very, very selective, even which journals you publish in. And so for students and for new professors, what do you think is the best strategy for gaining the potential that open access has for increasing your amount of citations while still kind of...
I just said it.
Just put it online also.
Closed access and hit the button.
All right.
There's your answer.
Just quickly, for those who have a doubt about the legality of what they would be doing or not, there's a really good site called Sherpa Romeo. Every journal, more or less, where you might think of publishing will be listed there, and they'll tell you what you can do with your paper. That is, can you put it in a self-archive, in what stage you can put it, and so forth. So you'll see what you can do. And what I would suggest is also put pressure on the publishers. Don't publish in journals where publishers are trying to restrict access. It's the first step. It's one of the steps.
Yeah, like don't publish with the ACS anymore. Forget it. I mean, you can't give that kind of advice to students. The prestige journals are embargoing. So publish wherever you want, and get around it.
Yes, yeah, go ahead.
So thank you very much for an excellent panel. I just realized how much reverb there is on this when I use it. So, I just wanted to touch up on something I think that was on Dr. Archambault's slide, that if we're moving away from a subscription model where libraries pay for it and we're getting researchers to pay for it, I just wanted, I guess, everybody's thoughts on how that's going to affect research funding, because funding is tight and there's research is expensive as it is, and if you have to spend $5,000, which is the range, to submit it in open access journals, and of course if you wanted to submit it in so-called high impact or journals that are well established, you're going to have to pay more. So in a way, if you're a well-funded researcher, your door just opens up to publish it in a better journal, and hence your research reaches more people automatically because it's high impact. So I just wanted your thoughts on, when we move to that kind of model, how are people that are just breaking into science or new labs that are setting up, how can they afford to pay, I don't know, $5,000 to get their paper published, their first paper published? Is it within their budget? Does the government need to think about this when they plan budgets? Thank you.
Well, there are several dimensions to your question. First, it doesn't cost anything to be green open access, as Etienne keeps on saying over and over and over and over again. Just self-archive. That's for free. Do it in any journal. And, you know, I look forward to having a publisher coming and suing McGill for having something that a McGill researcher wrote that can be found in the repository. It's not going to happen, okay? If they start doing this, it's going to be the end of the world for them. Now, if you think long-term, the money is already in the system. Libraries are paying for subscription. At some stage, no more subscription, money is reshuffled, available for researchers to pay some fees to make sure that the system still works. It's going to take some time. You're going to have gales of creative destruction and creative reconstruction. But the money is there already. Actually, there'll be, if Etienne is right, there'll be more money because the market will start working better. Economists would be happy. We'll have a real market functioning, and we'll be closer to marginal cost than at the moment. The profits of the largest editors are insane. You're speaking about 40% profit margin for Elsevier. Basically, these companies have understood the same thing as Nestlé. Bottled water is great.
Well, oui, vas-y, Florence.
Est-ce que c'est déjà arrivé? Do you know of a case where a publishing house sued a researcher?
Physicists have been doing it since 1991. There has not been one single suit.
So do it. Do it.
It's not going to happen.
I just want to share with you one of your questions. CIHR actually has a policy. You can budget your open access costs in your grant proposal, and it's usually paid for. So it's not that, and I applaud CIHR's thing, the policy that allows us to share our open access. I recently wrote an editorial where the publisher said that, can you pay like the $1,300 to make it open access? I said, well, if I have to pay $1,300, then I want my article back, because I want it to be open access. Then they said, can you pay $350 for giving us color and print copies? And I said, what you do is you give me a color copy, and then I'll pay you $350. So, the thing is, the ball is in our court. We just have to wake up and smell the coffee. And the coffee is good.
Yes, and it's better than bottled water, I think. But just on that, before I thank our excellent conférencier, let me use the moderator's chair to make two quick announcements. For those of you who are keen, and this is going to come up in the PhD bubble discussion later on, for those of you who are looking at this thing called science society, science policy, and so on, apart from this wonderful exchange program that does exist here at McGill every year, which I'm very happy to be part of, there are two upcoming events, just to note for what it's worth. One is something called the Canadian Science Policy Conference in Toronto in November, which I think Vas has put up on the website, and it's available at a very good gathering every year of the players who are involved in both from the research side, but also from the public policy side, et cetera, who are engaged in this. So that's coming up in November 20th, 22nd in Toronto. And then the institute which I represent, the Institute for Science, Society, and Policy at Université Ottawa, has a upcoming conference on the 20th to the 21st to the 23rd of October in Ottawa on the emerging agenda for science, society, and policy. Two of the speakers at this table will be there. So for those of you who are interested, you can come and see them again. So I just wanted to make that point for those of you who may be interested in the whole issue about next careers. On that note, je remercie nos conférenciers. I think they did an excellent job. And I thank you for your participation. Merci beaucoup. Et on se revoit au pause café. Merci.